Every year, thousands of workplace injuries happen because hazards go unnoticed. But what if you had the skills to identify dangers before they became disasters? For example, in the healthcare sector, musculoskeletal injuries are a significant concern. For instance, in Ontario, Canada, the lost time injury rate in the healthcare sector was 1.27 per 100 workers in 2015, ranking above the overall lost time injury rate for Schedule I employers. Additionally, injuries resulting from overexertion increased by 19% between 2020 and 2022, often due to strains from excessive lifting of patients and medical equipment. These statistics highlight the importance of recognizing and mitigating hazards in healthcare settings. In this video, we'll walk you through a step-by-step process to recognize workplace hazards and keep yourself and your coworkers safe. The first step to recognizing hazards is knowing what to look for. Workplace hazards generally fall into 5 main categories: physical hazards, slips, trips, falls, noise, extreme temperatures. For example, in a hospital setting, a nurse might slip on a wet floor in a patient's room, or prolonged exposure to high noise levels from medical alarms and equipment can lead to hearing issues. Chemical hazards, toxic substances, fumes, and spills. In a healthcare setting, this could mean exposure to hazardous medications, disinfectants, or anesthetic gases. For example, a nurse handling chemotherapy drugs without proper personal protective equipment could be at risk of contamination. Biological hazards, viruses, bacteria, and mold exposure. For example, in a healthcare setting, improper handling of contaminated medical instruments can lead to the spread of infections. Additionally, failure to follow proper hand hygiene protocols can result in the transmission of bacteria and viruses among patients and staff. Ergonomic hazards. Poor workstation setup, repetitive motion injuries. In hospitals, repeated patient lifting and transferring can lead to serious back injuries among nurses and caregivers. Poorly designed workstations in administrative areas can also cause strain injuries. Psychosocial hazards, high demanding patients, stress, bullying, and fatigue. Healthcare workers often face high-pressure environments, long hours, and emotionally demanding situations. For instance, a doctor working multiple consecutive shifts may experience burnout, leading to impaired decision-making and increased risk of errors. A thorough workplace inspection is essential for identifying hazards before they cause harm. The goal is to proactively spot risks, document findings, and take corrective action. There are 2 effective ways to conduct an inspection. Walk-through inspection. Systematically walk through the workplace, observing different areas, equipment, and tasks. Pay special attention to high-risk zones like patient rooms, storage areas, and medication handling stations in healthcare settings. Checklist method. Use a structured checklist to ensure all potential hazards are assessed. This could include checking if emergency exits are clear, ensuring biohazard waste is properly disposed of, and confirming that patient lifting equipment is in good condition. During the inspection, it's important to take detailed notes and document any identified risks. Engaging with employees and inquiring about safety concerns they've noticed in their daily work is also beneficial, as frontline workers often have first-hand knowledge of hazards that might be overlooked. After completing the inspection, findings should be reported to the appropriate safety personnel, and immediate corrective actions should be taken when necessary. Regular inspections can significantly reduce workplace incidents and improve overall safety. Conducting regular workplace inspections is a critical component of maintaining a safe work environment. These inspections help identify potential hazards before they result in injuries or fatalities. For instance, the Occupational Safety and Health Administration conducted 34,696 federal inspections in fiscal year 2024, underscoring the importance placed on proactive safety measures. Research indicates that such inspections can lead to significant safety improvements. A study focusing on high-hazard industries in California found that workplaces subjected to randomized safety inspections experienced a 9.4% reduction in injury rates and a 26% decrease in injury costs over the following 4 years, compared to similar uninspected workplaces. Regular and well-conducted workplace inspections not only enhance employee safety, but can also lead to substantial cost savings for employers by reducing injury-related expenses. Overall, they remain a fundamental component of a comprehensive workplace safety strategy. Hazards in the workplace can stem from two primary sources: unsafe acts. These are risky behaviors performed by employees that increase the likelihood of an incident. Examples include failing to wear PPE, improper patient lifting techniques, or rushing through tasks without following protocols. Unsafe conditions. These are environmental hazards that make the workplace dangerous, such as broken equipment, poor lighting, or wet floors that increase the risk of slips and falls. An example of an unsafe act: a nurse is in a hurry and skips proper hand hygiene after handling a patient with a contagious illness. This simple oversight can lead to the spread of infection, putting both patients and staff at risk. An example of an unsafe condition: in a hospital setting, a vital piece of medical equipment such as an IV pump malfunctions. Due to a delay in maintenance, the pump delivers the wrong dosage of medication to a patient, resulting in an adverse reaction. Statistics. The CDC reports that 1 in 31 hospital patients acquire a healthcare-associated infection due to lapses in hygiene and sanitation. OSHA data indicates that overexertion-related injuries, such as improper patient lifting, account for 48% of reported injuries among hospital workers annually. One of the best ways to recognize hazards is by asking, "What if something goes wrong?" This method helps uncover hidden dangers before they lead to incidents. Consider these questions. What if this ladder isn't secured properly? Who would be affected? How severe could the injury be? Are there better ways to ensure ladder safety? What if an emergency exit is blocked? How would staff and patients evacuate in a fire? What alternative escape routes exist? Here is an example scenario. A nurse is transporting a patient on a stretcher in a hospital hallway. They approach an emergency exit but find a supply cart blocking the doorway. What if a fire alarm suddenly goes off? How much time would be lost trying to clear the exit? Could a panicked response lead to injury? Now let's expand this thinking. Who is involved? The patient, nurse, and possibly other staff members. How could things change if safety procedures were followed? If staff followed proper storage rules, the exit would remain clear, ensuring safe evacuation. Are there other ways to prevent this hazard? Implement routine hallway checks, post reminders about keeping exits clear, and train staff to recognize and report obstructions immediately. Recognizing hazards is just the beginning. The next step is reporting them. This is so important. I have seen way too often someone recognizing a problem and then continuing on with their work or life. The reason we continue on and pass by is most likely based on our risk tolerance. But that can be a whole other lesson in itself. For now, we'll just stay on track here. Proper documentation and reporting ensure that issues are addressed, and safety measures improve over time. Fill out an incident report. Clearly describe what happened, where, when, and who was involved. Notify a supervisor or safety officer. Reporting ensures that corrective action can be taken promptly. Follow up to ensure corrective action is taken. A hazard left unaddressed could lead to repeated incidents. Imagine a nurse notices a frayed power cord on a vital heart monitor. Instead of assuming someone else will handle it, they immediately document the issue, report it to the safety officer, and request a replacement. Their quick action prevents a potential electrical hazard that could have harmed both staff and patients. By properly reporting hazards, healthcare teams create safer environments and build a stronger safety culture. These reports also serve as learning tools, allowing workplaces to track trends and implement preventive measures that reduce risks in the future. Following up to ensure corrective action is taken is crucial because unaddressed hazards can lead to repeated incidents. By thoroughly investigating incidents and reports, you can identify hazards that are likely to cause future harm. Proper incident reporting helps minimize risk and ensure that similar incidents don't occur again. Additionally, following up signals to employees that management prioritizes their well-being and is committed to providing a safe work environment. This leads us straight into our next step. Once a hazard is identified, steps should be taken to eliminate or control it. Implementing preventive measures is crucial for maintaining a safe workplace. Ensuring that corrective actions are taken after reporting hazards is crucial for maintaining workplace safety. Unaddressed hazards can lead to repeated incidents, posing ongoing risks to employees. For instance, in 2011, U.S. hospitals recorded 58,860 work-related injuries and illnesses that caused employees to miss work. These measures not only protect employees from potential hazards, but also enhance overall productivity and morale. Here are key strategies to consider. Conduct comprehensive risk assessments. Regularly evaluate the workplace to identify potential hazards. This involves analyzing work processes, equipment, and environments to detect risks before they result in incidents. Engaging employees in this process can provide valuable insights into areas that may be overlooked. Develop and enforce robust health and safety policies. Establish clear policies that address identified risks and comply with legal requirements. These should outline procedures for emergencies, safe work practices, and mechanisms for reporting safety concerns. Ensure all employees are familiar with these policies through regular training and accessible documentation. Foster a culture of safety. Encourage open communication regarding safety concerns and recognize employees who contribute to a safer work environment. Leadership should lead by example, demonstrating a commitment to health and safety in all actions and decisions. Implement engineering controls. Where possible, redesign workspaces or processes to eliminate hazards. This could include installing ventilation systems to reduce exposure to harmful substances or implementing machine guards to prevent accidental contact. Provide personal protective equipment. When hazards cannot be completely eliminated, provide appropriate PPE such as gloves, gowns, or eye protection. Ensure employees are trained on the correct use and maintenance of this equipment. Offer regular training and education. Continuous education ensures employees are aware of potential hazards and the correct procedures to mitigate them. Training should be tailored to specific roles and updated regularly to reflect any changes in processes or regulations. Establish emergency preparedness plans. Develop and communicate clear procedures for emergencies such as fires, chemical spills, or natural disasters. Regular drills can help ensure employees know how to respond effectively in crisis situations. By systematically implementing these preventive measures, organizations can create a safer work environment, reduce the likelihood of accidents, and promote a culture that values health and safety. Statistics underscores the importance of promptly addressing identified hazards to prevent future occurrences. Encouraging a safety-first mindset in the workplace is essential for preventing incidents and promoting a culture of well-being. Here are some strategies to foster this mindset. Promote open communication and feedback. Encourage employees to report hazards, voice concerns, and participate in safety discussions, fostering a sense of ownership and shared responsibility. Invest in comprehensive training and development. Provide employees with thorough safety training programs that go beyond basic checklists, equipping them with the knowledge and skills to identify and mitigate risks. Lead by example. Ensure that leadership teams actively demonstrate their commitment to safety by adhering to safety policies and setting positive examples for employees. Foster psychological safety. Create an environment where employees feel safe to speak up about safety concerns without fear of retaliation, which is crucial for a high-performing organization. Implement regular safety reminders. Consider simple daily reminders, like a safety tip of the day or brief check-ins at the start of each shift, to keep safety fresh in everyone's mind and help make it second nature. Encourage employee participation. Involve employees at all levels in making the workplace safer and encourage the communication of hazards with management. By implementing these strategies, organizations can cultivate a robust safety culture that prioritizes the well-being of all employees. Unaddressed hazards in the workplace can lead to repeated incidents, posing significant risks to both employees and the organization. For instance, in healthcare settings, unreported safety risks can result in injuries to workers and patients due to factors like lapses in infection control, fatigue, or faulty equipment. Studies have shown that a substantial number of safety risks go unreported. A study by the RAD Group found that individuals report safety risks only about 39% of the time, meaning approximately 60% of safety risks remain unreported. In healthcare, this underreporting can lead to increased workplace violence incidents, which are already prevalent in the industry. The Occupational Safety and Health Administration, OSHA, notes that many workplace violence incidents in healthcare likely go unreported, exacerbating the issue. Therefore, it's crucial to follow up on reported hazards to ensure corrective actions are taken. Neglecting this step can result in repeated incidents, compromising workplace safety and employee well-being. Now that you know how to recognize hazards in the workplace, it's time to act. Does taking action work? Absolutely. In 2023, private industry employers reported 2.6 million non-fatal workplace injuries and illnesses, marking an 8.4% decrease from 2022. Specifically, the healthcare and social assistance sector saw a reduction to 562,500 cases in 2023, down from 665,300 in 2022. I want to hear your own workplace safety experiences in the comments below. And if you found this video helpful, don't forget to share with your fellow coworkers, subscribe, and turn on notifications for more safety tips. Stay safe out there.